Hello, my name is Reese. I work for Person Centered Software, and we're going to do a short video case study with Ant Mitchell, who works at Park Lane Healthcare. So welcome, Ant. If you could just give us a brief intro into your journey so far with PCS.
Yeah, my name is Ant Mitchell. I'm an operations director and also IT director as well for my sins. I've been working with PCS for 18 months, but as Park Lane Healthcare, we've been going since 2006. We currently own 7 care homes, all in the north of England, and 6 of them have got PCS installed at the moment. We were sadly delayed on the last one because of the lockdown. But we've got about 300 residents, about as many staff as well. We trialed PCS in one home first to see if it was what we were looking for, and it very much was. And so throughout the whole of 2019, we spent a lot of time installing it in the other homes, supporting the staff, because it's a bit of change. It's never easy when change is involved, and it's been a big success so far, and it's been particularly useful during this pandemic. But yeah, that's where we are at the moment.
So you just mentioned the pandemic a few seconds ago. So how has PCS supported the organisation during the lockdown period?
It's been an absolute godsend, because we were quite strict in terms of the lockdown. We started up a good week or so before the rest of the country, right. And so since then I've not set foot. We've been to the homes, but we haven't set foot inside, because however theoretical the risk is, it's still a risk bringing the virus in. And we've been COVID free throughout, so we want to maintain that as much as possible. But in terms of how PCS has helped, it's taken away the horrid prospect of there being a loss of control or a sense of control, because on paper-based systems, it's you've got to be in the building to look at documentation. You've got to look at care plans physically. You've got to either be there physically or spend a tremendous amount of time digitizing and scanning the information, which just was unmanageable before we had PCS, really, but certainly in the last couple of months it would have been a nightmare. We felt so much more comfort knowing that we can look at the information whenever we want. I mean, I've always used to joke about the fact I would be upstairs on a night putting my daughter to bed, and I'd be looking at bowel charts on my phone, just because you can check these things without having to be there. And it's been such a great tool to have, because there's nothing you can't see, and there's nothing you can't check up on, and that's important, particularly at the moment.
Yeah, because you've not been able to go and visit any of the homes, so no. You've had that visibility through one system across all the homes. So yeah. How have the managers perceived that, knowing that you're not going to be able to go there?
Yeah, they used PCS in a bit of a different way to what I do at sort of this level. For me, it's more about sort of top down and drill down. So you look for things, and then if you see something you don't want to see, then yeah. you investigate it further. Whereas the managers, we use the information on a day-to-day sort of basis. They don't necessarily have time during the day, particularly at the moment. It's been a stressful time for everyone, although we've not had the virus in any of the homes so far. There's still a lot to sort out and a lot to take account of to make sure that we stay that way. So they don't perhaps have the time to think, right, okay, well, let's just check this, let's just check that. Whereas we do, because although we're taking sort of hourly decisions, or we certainly were in the early days, yeah. hourly decisions on what do we do about this, what do we do about that, have we got enough this, have we got enough that. But we've got the time to sit and investigate a bit more in top level, a bit like the group reporting side of PCS. But they've really enjoyed them. Don't get me wrong, they sometimes think, oh, why is he asking that question again? But it's important, and they realise that all we're trying to do is make sure that their lives are easier through having an extra layer of checking and redundancy almost to make sure that we don't miss anything. That, you know, with all the greatest will in the world, helping to make sure COVID doesn't come into the home sometimes means that you take your eye off the ball in other areas, and it's about all supporting each other. And
so they're safeguarding themselves as well.
Yeah, it's about making sure that you have done everything that you can, and you can evidence that you've done everything you can, and that's something that's not always possible with paper-based systems, because documents get lost, they get damaged, they fall out of folders, or the folder goes missing, or someone pours a cup of coffee over it by accident. So it's all, you know, having that information up to date and to the minute is fantastic for us.
Can you tell me a little bit about how you're using the export features within mobile care monitoring?
Yeah, so PCS has got a thing called group reporting, and it's how it sort of caters towards the more sort of higher level information gathering. It's not a one size fits all system, because that's just not possible. You're not going to accommodate everyone's requests and everyone's tastes and in one layout. So PCS do this thing where they can customers access to export as much information as they possibly can at the moment, and there are plans to increase what's coming through. But you take as much information as you want and have access to from PCS, and do what you want with it in terms of processing it. Now, because of my background in IT, I've gone slightly further than perhaps the majority of users will ever do here, although there are some people that are doing more than me. But basically, I wrote a program which takes hourly, daily, weekly, monthly information and puts it into a database. And then that database links in with a dashboard graph software thing called Power BI. And Power BI is a well-known Microsoft program that lets you examine KPIs. It lets you manage information, and lets you present it in a much more graphical and easy to understand manner.
And so basically, person-centered software is your pool of evidence, and what you're doing is you're using the APIs just to select the different strands of information you want and pulling it together in your own customized graphs. So the managers are in PCS on a daily basis, but what you're doing is plucking the different strands out to give you the data in a more aggregated view.
As I think I said earlier, the managers are using it on a day-to-day constant basis, whereas I'm not doing that, and certainly not at the moment. I can't do that because I'm not there to be able to do that as well. But having that process taking place means that I can focus on other things without having to go, oh, I need to remember to look at the bowel movements, I need to look at the weight charts. So whilst the managers will be doing that as well, and the unit managers and the seniors will all be looking at bowel movements at the start of the shift, it makes me feel better knowing that I'm also able to view that information, but also be a bit smarter with it and make it do the work for me, so that I can then just say, we need to focus on that, rather than I wonder if there are any residents that are this or that. That's been one of the big, certainly in this process started around December, January time. So I was already starting to work on it before the coronavirus came along.
So that's really hitting those safe and well-led areas.
Right. Hopefully,
What impact do you think coronavirus will have had in shaping the care home of the future? So, for example, connecting more with the outside world.
The IT infrastructure is key because one of the big things here has been the use of social media. It's been the use of things like FaceTime, Skype, and Zoom, particularly, and Microsoft Teams. One of the great things about PCS, and one of the lucky things for us, was that prior to obviously this all kicking off, we had to improve our IT and our Wi-Fi signals throughout the homes, so that the phones the staff use when logging on PCS can work effectively, rather than having to run back to a central hotspot where it was working. So that's meant that when this has come along, the COVID's come along, staff have been able to take tablets up to people's rooms, or just use them in other areas that they wouldn't have otherwise done. And we can give the families that access to their loved ones, because you can take pictures on Facebook, and staff and residents and relatives themselves can see those pictures and comment on them and think, great, this is wonderful. But nothing compares to actually having a face-to-face chat, even if it's a virtual one. And that, and I know there's we don't use it ourselves, but there's the relatives gateway on PCS as well, which allows relatives to sign in and leave messages and leave photos that the staff can then show the resident when they're when they're with them on their phones. The social media for GP consultations and things like social services reviews, that sort of thing, have all had to rely a lot more on the use of technology, and I think it's a good thing generally. There's nothing quite compares to having a face-to-face meeting. If a social worker wants to view how a resident is behaving in a certain situation, that's always going to be better in person. But if that's not possible for time restrictions, or in this case physical restrictions because we can't visit the homes, then use of that sort of thing is going to be very important, and they need to have that sort of thing in place, really.
Yeah, so if you've got the base, even just the basic Wi-Fi infrastructure in place, you can then bring in any other service at any time that you need, because you don't then have to think about, oh, well, the Wi-Fi is not good enough in that room, we're going to have to move the resident. So you spoke to me previously about an example where having the digital system in place and enabling you to see so much information about a particular resident that the daughter was particularly worried about weight loss.
It was just a couple of days ago, in fact. We have a website and it's got a contact section, and a relative sent in a query, really, just to say that they loved that they were seeing on Facebook, but that she noticed a picture of her mum, and she said that she looked a bit thinner than she had remembered her, and was there anything to be concerned about? And this was on, I think it was Sunday lunchtime. So I saw the email come in, because I get the emails that come through, and what would have happened in the past is I would have had to email the manager or ring the manager and say, can you look into this for us, because this relative says that she's concerned. But because of PCS, I logged on to PCS, I looked at that lady's care plan, I looked at her assessments, I looked at her weight charts, and was able to see that yes, she had been losing a little bit of weight, nothing drastic, but gradually going from the overweight category into the normal category, which is fine in itself anyway. But that the manager of that home had put a note on the care plan evaluation the previous month to say that if this month in June there was still a further loss, because depending on the needs of the resident, they're either weighed weekly or monthly usually. If there was a loss still, then she would refer that person to the dietitian. I thought that's great. So I checked first that she was the power of attorney for that person, and that she had the relevant rights to ask that, to request and then get that information. And it was all fine. So I then sent the summary of all that, and she was blown away by how quickly we're able to respond, and that despite not being on the premises, we could give them that information and give that reassurance. And she said that the reason why she's probably losing weight is because she can't visit and give her all the sweets and chocolate that she normally does. So she's probably a good idea. It's probably a good thing that she's not getting those sweets and that chocolate at the moment.
Right.
She thanked us for how much she'd set her mind at rest, and a couple of days later, I think she sent a load of chocolates to the home to give to the staff and the residents as a thank you for it.
That's a really good example of that relative just feeling really comfortable with the fact that everything is, everything that you need to know about her mum. Probably around 70% of care homes are still on paper. So what would you recommend to those care homes, whether they're part of a group or even just single homes?
Yeah, you sent that figure to me once before, and I still can't quite believe it now. It's particularly from the other side of it, as it were. We always thought that our paper-based systems were good, and they were. We were getting goods from CQC consistently. We'd been doing it since 2006. We knew what we were looking for. We knew what we were doing, and so we thought there's no point to getting a digital system, because everything's in place that we need to. But as things have got more complex, care isn't about nutrition isn't about sticking another can of beans into the soup anymore. It's it's complicated, it's complex. We use Appetito in our care homes, and they give you all kinds of nutritional information that you can use to then target residents who are losing weight but just need a bit more sort of calories in their diet, and you can tailor that person's nutritional intake because you've got all the information. It's not just a case of shoving the can of beans in there. So you need to take all those things into account. Care plans are far more complicated than they used to be. I mean, it wasn't that long ago that it was one page that covered everything for someone who'd been in there for 6 years. Everything has to be documented. If it hasn't been written down, if it's not documented, it hasn't happened. So there's a lot more overhead now, I suppose, in terms of making sure that everything is up to date, that you are checking things, and it's harder to document evidence that you are checking if it's on a paper-based system too. You can write notes and you can do this and you can do that, but you can't. If CQC walk in, how do you evidence that you've checked that a person's weight has been recorded? And other than creating a separate document that tells you, I have looked at this person's weight, it's very hard to do that, and PCS just gets rid of that problem for us. But in terms of what I'd recommend, I'd say even if you are a single owner, an owner manager person who spends 8 to 10 hours a day, sometimes more, in the home and have access to the paper-based records, seriously think about whether a system would still be a big help to you, because as I say, we're not a large corporate. We can afford the systems anyway because they're not cheap, and a good system shouldn't be cheap. PCS is worth the money. We think it's probably best if you've got more than one home to have it, because it means that the economies of scale and that sort of thing, but also how you can compare one home to another. You can do that like that with PCS. You can see how one home's fluid levels are doing much better than others, and what is the reason for that? Which we decide is wrong. Digital systems make life a lot easier for people using them, and I know staff are sometimes resistant to change, and it was certainly the case in a couple of homes for us that we had one person springs to mind at the first home we installed it at, who didn't even have a smartphone. She was scared to death that she was going to do something wrong, that she was going to put something in wrong and it was going to explode. And within a couple of weeks of using it, she was one of the highest, because you can see who's logged what and how often and what they've been doing. And she was top of the list. She just took to it like a duck to water.
I've heard that so many times, that quite often the carers that are perhaps a bit older or the most nervous, quite often they become the power users because they realise just how simple it is to use and how much it changes their life on a minute-by-minute basis as they're logging care. So that has been fascinating, and so thank you very, very much. And thanks for your time.
Thank you. It's been good. I just want to say to all the providers out there that are watching, everyone's done such a fantastic job in dealing with this. The mainstream media haven't been, although they think they are now, they haven't been the friends to residential care during the majority of this crisis. They've portrayed us all as ineffectual, that we don't know about infection control, that we don't know about PPE, and that we need hand holding, and that the care homes are war zones. It's not the case for the vast majority. And as I say, we're COVID free. And in some cases, we've had reports that we're the only home in the area that is. And I don't know what the reason for that is, other than us being religious with the way that we've enforced lockdowns and all that sort of thing. Mm-hmm. But the vast majority of care homes, I think it's like 2/3 anyway, have not had any cases, or certainly any significant cases. And that we're all doing a really good job. It's difficult, and we need to make sure that we look after the staff after all this, because they are the ones that if we disappeared overnight, the care homes would probably not miss a beat most of the time. But if we lost our managers and our carers and our domestics, then the place would grind to a halt instantly. So I just wanted to say that as a bit of a thank you to everyone who's done so much hard work our carers are fantastic, but they're no different to any other carer across the whole nation. And it's been lovely to see, for the wrong reasons, but it's been lovely to see.
Yeah, well said. Thank you very much.
Thank you.